Well, Sydney is facing a growing cluster of COVID-19 cases on its northern beaches. It has triggered the closure of borders again, throwing Christmas travel plans for many into chaos. The local government area starts at Manly in the south, out to Frenchs Forest in the west and north to Palm Beach, is home to 250,000 people. Well, the New South Wales Premier Gladys Berejiklian has told people to brace themselves to expect a considerable amount of new COVID-19 cases today. Reporter Alexia Atwood joins us now from Sydney. Good morning to you, Alexia. Can you take us through the latest details?
Morning, Kath. Yes, well, there is a lot of nervous reaction to that sombre warning from the Premier, Gladys Berejiklian, that the community on the northern beaches needs to be bracing themselves for more cases that are going to be confirmed later today when we have a press conference around 11 o'clock. And we have also found out through genomic sequencing that the strain that's circulating in the northern beaches seems to have originated from overseas, but we at this stage do not know how it got into the community. So far, we're aware of 17 cases that have emerged in the last 48 hours. And New South Wales Health is urging everyone to not travel in or out of the northern beaches. In fact, everyone in these communities are going to need to stay at home for the next 3 days. That means that they should be staying within their household groups, avoiding non-essential gatherings and working from home. People are also being encouraged to wear a mask, which is what I have been doing as I have been here out in the community, particularly at Avalon. And this is to give contact tracers a chance to get on top of the contact tracing and to slow down the spread of coronavirus. Now, one case that is concerning that we've learnt about is that a man from Frenchs Forest who was in a band, and that means that he performed at several venues across Sydney, including at the Penrith RSL, all the way out in Sydney's west, so far away from the northern beaches region. He also performed at the Kirribilli Club and, crucially, the Avalon RSL. Authorities are working on the hypothesis that this could be a particular place where the strain originated from and where a number of people picked up COVID-19. But yes, the situation is an evolving one. Let's hear from the Premier, Gladys Berejiklian.
We're bracing ourselves for more cases today, no doubt about that. I'll be providing an update with the Chief Medical Officer and the Minister for Health at 11 a.m. this morning. But we are concerned, extremely concerned, and that's why we're saying to everybody on the northern beaches in the northern beaches community, stay home unless you absolutely have to be out and about.
Now, Alexia, you mentioned you are at Avalon. How are the people there feeling?
I would say uncomfortably warm. The line here has snaked all the way around the perimeter of the path. You can see some people behind me are stepping out of the queue slightly to sit in the shade. Many people have come equipped with umbrellas and podcasts and books and seats, as they were envisaging that this would be a rather long wait. And New South Wales Health is encouraging everyone to get onto the New South Wales Health website to not only track the venues that are of concern to see if your movements align with those venues of concern, but also to look at the number of different testing clinics that are available on the northern beaches to hopefully ensure that not any particular testing clinic gets too congested. The mood here is sombre. There's lots of thoughts being spared for those people whose Christmases have already been ruined because they've already been identified as close contacts and are going to need to be isolating over Christmas. And there are also concern here for everyone in these queues for themselves, because obviously this is an emerging cluster, and it's been particularly nerve-wracking to hear that latest warning from the Premier, Gladys Berejiklian. Some people are in good spirits. Some people are managing to run into lots of neighbours while keeping their distance and wearing masks, just sharing news of what they know of the situation and what they're learning. Others are feeling quite frustrated, particularly as the lines are so long.
Frustrated and a bit apprehensive as well, and have to line up in this line for God knows how long with the kids to try and get them tested. And we did it last time at the very first of the break, and this one here just cracked it. So, yeah, not looking forward to that.
I'm very disappointed about these long queues, and I would have thought they could have brought in many more testing stations. My husband waited 4 hours yesterday at Monavale Hospital. I waited 2 hours here last night and then gave up and thought, well, I've just arrived here at 6:15, thinking, and it opens at 8 o'clock, and there's already probably 150 people here.
So, Kath, people are again being encouraged to get onto the New South Wales Health website to look at those venues of concern and also to look at the number of new testing clinics that have become available. And everyone is eagerly awaiting that 11 o'clock press conference. We're expecting to hear from the New South Wales Chief Medical Officer, Dr. Kerry Chant, and potentially from Gladys Berejiklian herself as well, to find out more information about the genomic sequencing and more cases that are emerging, and of course questions over this suggestion for people in the Northern Beaches to stay at home and see if those are the same instructions that are going to apply or whether things are going to be extended even further.
Alexia Atwood joining us live from Avalon in Sydney's north. Thank you. Well, as we've mentioned, 30 sites on the Northern Beaches have now been listed as potential exposure points. Those include several supermarkets, a Commonwealth Bank branch and a chemist warehouse outlet. You can look through the full list on our news website. It's in an article titled "What We Know About New South Wales' Latest Coronavirus Cluster," which is front and centre of abc.net.au/news. Well, state and territory governments are changing their border arrangements with New South Wales in response to the Northern Beaches cluster. Reporter Stephanie Ferrier is in Melbourne and she joins us now. Steph, can you take us through how Victorian authorities are responding to this outbreak?
Good morning, Catherine. Yes, we've spoken to Jerome Weimar, who's the testing commander here at the Department of Health and Human Services, and he says that they're understandably very worried about this situation in the hotspot with the Northern Beaches. And Victorians are understandably as well very jumpy after having endured those months of tough lockdowns. We are jealously guarding our 49 days of no local cases here. Those figures have just come out. We only have one case that's come up, which is among an international traveller currently in hotel quarantine. But what we have been seeing a lot is people demanding that the border with New South Wales is closed. When we asked Jerome Weimar about that, he said all options are on the table. Now, what he is doing and what they have already asked is for anybody who has come in from Northern Beaches or other high exposure sites in New South Wales since last Friday to get tested immediately and also to self-isolate for 14 days. Now, that does mean that those people who have come in after last Friday will miss those Christmas celebrations. At the moment, that's not a mandatory call, that is still a request, but we are hoping that everybody will abide by that. Now, we are also expected to see whether or not the government is going to announce any further details today about what will happen for travellers as of midnight. So we are expecting that Jerome Weimar says that they are monitoring this situation with New South Wales authorities on an hour-by-hour basis, and that if measures need to be escalated, then they will be. Now, we also have a very similar situation happening over in Western Australia, where they have imposed restrictions as well. And in fact, some of the travellers were told of this mid-air as they were still on their flight, that they would have to go into isolation. They are going to need to stay in isolation until they test negative. The situation is similar up in the Northern Territory as well. And as of midnight tonight, they will in fact have to go into hotel quarantine at a cost of $2,500. And we've also seen in Tasmania the borders, or the people being denied entry if they come from these hotspots. They simply won't be allowed into the state. We're still to hear what South Australia is going to do as well.
Steph Ferrier, thank you so much for joining us and giving us an update on that. Well, let's cross to Queensland now, where that state has imposed new border restrictions a week out from Christmas. Our reporter Talissa Siganto joins us now from Brisbane. And Talissa, can you take us through Queensland's position on this outbreak in the north of Sydney?
Well, Catherine, not long after news broke yesterday that cluster was increasing and it increased to more than a dozen. Health authorities here wasted no time imposing new travel restrictions. Our Chief Health Officer, Dr. Jeanette Young, she made a late night directive which will affect anyone who's been in the Northern Beaches region since last Friday. Now that's both Queenslanders who are returning home and anyone who's visiting. So from 1 a.m. tomorrow, anyone who has been in that area since last Friday, they will have to go straight into mandatory hotel quarantine and they'll have to pay for it as well. Now, as for anyone who's already here and have been in that local government area since last week, or anyone who arrives today before that 1 a.m. cutoff, they're being told that they have to go and get tested and immediately self-isolate for 2 weeks from the date that they left Sydney. So whether that's at their home or where they're staying, they're being told they can't leave for at least that 2-week mark. Now, as you said, this has obviously disrupted a number of people's travel plans from both New South Wales and Queensland over this holiday period. But here in Queensland, we were warned that this would be a possibility, or could be a possibility. Earlier this week, when that first case did pop up in Sydney, our Chief Health Officer, Dr. Jeanette Young, said that she was monitoring this situation really closely, and she did advise people that if they were planning to travel to even Greater Sydney for the Christmas period, that they should be prepared that there was going to be a risk that it may be declared a hotspot, or areas that did have those high case numbers could be declared hotspots.
Yeah, Christmas chaos all round. Talissa, Siganto, thank you for the update from Brisbane in Queensland. I'd like to take you to some breaking news now. And Tasmania has now declared Sydney's northern beaches a high-risk area, meaning no travellers from that local government area will be allowed to enter the state without an exemption. The same applies to travellers who visited any of the high-risk areas of Sydney listed on the state government's coronavirus website. Those who are already in Tasmania are being urged to self-isolate and arrange a coronavirus test. The government says further high-risk areas may be added to the list, and an update on Tasmania's border controls is expected a little later today. Well, federal ministers are questioning some of the decisions being made in response to the COVID-19 cluster in Sydney. As we've just heard, a number of states and territories have imposed restrictions on people coming from New South Wales. Political reporter Stephanie Boris joins us now from Parliament House. Good morning to you, Steffi. Can you take us through what the ministers have been saying this morning?
Well, there is a concern around this stop-start mentality that we're seeing whenever there is an outbreak of COVID-19. Federal government ministers obviously worried about the impacts that has on the economy. And we've heard from the Finance Minister, Simon Birmingham, this morning saying that both state and territory leaders need to respond with caution, but to keep in mind that the New South Wales tracing and contact system is very solid, that it has worked in the past, and that at a federal level they have great confidence that it will work in this case again. Now, as we've heard this morning, the restrictions are different depending on which state and territory you're trying to go to if you're coming from New South Wales. WA, though, specifically, they've shut their border to anyone from New South Wales. So if you do want to go over there, you're technically welcome, but you have to self-quarantine for 14 days. And the Agriculture Minister, David Littleproud, has questioned this decision because it's very different from what the rest of the country is doing. They're looking localised, so just simply people that have come from the northern beaches. And he's questioned what the health advice is, stating that someone that lives 7 hours from Sydney's northern beaches, what risk they pose to the WA community. Now, we've also heard from the Treasurer, Josh Frydenberg, this morning. He said that hard border closures do cost jobs, and once again he is questioning the decision that's been made by the Premier.
I don't think a state closing their borders fully to New South Wales is necessarily the best response to this new cluster. What we need to do is support the New South Wales health authorities, get to the bottom of these new challenges, and have great faith and confidence in their ability to do so.